call more and more frequently and say, I don't have any control over this. I might as well just die. Nobody is going to help me.
I was paying last year $57 a month premium. It jumped up this year to $16.90 a month.
In 2017, 1/3 of the money raised on GoFundMe went towards medical campaigns. And the site raises $650 million a year for more than 250,000 medical campaigns.
There are people who will now be paying 50% of their limited incomes for health care. Does anybody in the world think that makes sense?
Health insurance companies know that 5% of their members account for 50% of all the costs. So I have this huge financial incentive to make their lives as difficult as possible.
I think it's kind of crazy how much these people make. You live this type of lifestyle, do you lose compassion? Do you lose empathy?
CVS Health spent a staggering $41 million in compensation to you and your colleague Karen Lynch. This is enough to cover the premiums for thousands of American families. How do you justify getting paid that much when so many of your patients struggle to afford skyrocketing premiums?
That was not my compensation that you referenced. This past year, my compensation was $17 million.
It was $17 million.
Of which one.
Pardon me.
What would you assume a cotton swab up the nose would cost? Take a guess. Your guess was $984. Hey, what the is going on?
On a completely separate note, I went to the dermatologist yesterday and we literally just had a conversation. No testing, no biopsies, nothing. The conversation cost $1,200 before insurance. What are we doing? I'm going to go bankrupt this year because I am just trying to take care of my health. I literally don't know how this country continues to operate this way.
This was just a visit. There was no procedures done. They took my blood pressure. That's it. This was just to have a conversation about what was going on.
You had put profits above patients, and you put profits above those who care for patients.
It honestly shocked me how difficult the process was to get approval for a life-preserving medicine for a disease that doesn't have many options. We are already fighting a horrible disease. We shouldn't have to fight insurance as well.
Oh, great! You're here to pay your bill.
No, we're not here to give you money. We're here to file a claim for my friend's medication.
Oh, you want money from us? Right through that door over there.
Hello.
Wow, that was a lot. But you know what else is a lot? Healthcare. Specifically American healthcare. Now, I'm no virtuoso when it comes to the medical field or big corpo in general, but when the general consensus on the internet is to risk life and liberty instead of being subjected to the cost, stipulations, and qualifications that is the medical and healthcare industry, then yeah, that's a giant ass red flag if I've ever seen one. And after seeing story after story, Reddit post after Reddit post, headline after headline, I thought to myself, it's long overdue for me to crawl out of the hibernation that is my bedroom, free myself from my ignorance to general knowledge, and diversify my cerebrum to actually gain a true understanding of what healthcare is, how it is being used, and the reality of the current state of healthcare, and why so many people are getting screwed over by the healthcare systems that have been in place for nearly a century now. Because it can't be all that bad, right? Right? See, that's what you call foreshadowing. Like everything in life, there is a beginning, a middle, and an end. And as with anything purposeful in life, its intentions are first usually wholesome for the common good and for the benefit of society. And healthcare was no different. Despite America officially founding itself in 1776, healthcare really didn't become an organized program until the early to mid 1900s. Until then, many colonial and 1800 practices of the time involved some of the most barbaric shit that I've ever had the displeasure of reading. Don't believe me? Well, let's just say that some of these practices and procedures included using cow's milk as a substitute for blood and blood transfusions, using alcohol and morphine in pediatric care, waterboarding to cure mental health disorders, using cigarettes to cure asthma, irony, transplanting animal organs into human bodies. I mean, I could go on and on, but I only hope that you would get the idea. At the same time, the barrier to entry to become a nurse or a doctor or someone who practiced medicine in general pretty much went something like this.
I am a surgeon! I am a surgeon! I am a surgeon! I am a surgeon! Dr. Hahn, I am a surgeon!
So yeah, the modern day equivalent to your average Redditor claiming to know what exactly it is that's making you unattractive to the opposite gender. It'd only take a number of deaths, disfigurements, and irreversible bodily damage for people to actually begin taking this health thing a tad bit more seriously, and I say that with the thinnest grains of salt, knowing that humans were still conducting lobotomies all the way into the 20th century. And if you don't know what a lobotomy is, then consider yourself highly blessed and favored, and I encourage you all to refrain from Google searching its meaning. What the hell, you're probably gonna search it up anyway. Look, a lobotomy is a neurological procedure where doctors sever your brain's prefrontal cortex. I don't know, the same thing that's responsible for your decision making, emotions, and mental skills, in an attempt to cure, you know, petty psychiatric disorders, you know, anxiety and depression and ADHD, things that plague like half of our society today. But getting back on track, over the course of the next few decades, with the natural advancements of medicine and science, the barrier of entry in the medical field drastically increased, and humans became more aware of nutrition, public health standards, sanitization, vaccinations, and an overall better scientific understanding of health. Life expectancy began increasing, diseases and flus of the past became less fatal, and the general concern over one's health and safety actually became a priority for many Americans. And while this progress was extremely encouraging in comparison to the last however many years of civilization, the increase in quality and knowledge most definitely came with its consequences. And with medicine becoming a more skilled and specialized practice, the amount of professionals at the time was in free fall, as becoming a physician actually became less of a participant's reward into something that was actually legitimized.
What are you doing there?
Using chewing tobacco for disinfect.
Bruh. Sure, that's what we always do. Cobwebs for the bleeding and chewing tobacco for disinfecting.
Here, let me in there. Yes, sir.
We have to get this man to a hospital.
No
quickly.
fucking shit.
Easy. Take it easy there.
The publication of Upton Sinclair's The Jungle, exposing unsanitary conditions, the creation of the Food and Drug Administration, better known as the FDA, the increased membership of the American Medical Association, the publication of the Flexner Report that exposed the substandard nature of most medical schools and exposed the lack of certification requirements amongst them, resulted in nearly 1/2 of medical schools closing around the United States, significantly contributed to the complete 180 of health and the medical field in the turn of the 20th century. And these changes held irreprehensible damage to anyone that was not white or male at the time, but that's like another rabbit hole for another video. And with the combination of better schools and physicians alongside higher success rates in the diagnosis and treatments of various ailments and diseases, resulted in healthcare becoming a bit tiered, if that makes sense. Some estimates put medical costs per household at roughly $103, which back then that was about 5% of the average annual income at the time, meaning that a lot of people who previously had access to the most basic forms of medical care were now finding it nearly impossible to receive medical care at a modest price. And wow, saying that sentence just makes me realize how little has changed in more than a century's time.
Get there, Pop.
We'll get there.
Physicians were in scarcity, but also experiencing its highest demand, raising costs and planting the seeds for healthcare to become less about the mission and more about the business. But for now, those concerns and qualms would be crushed as all eyes in America would turn to the next defining point in our country's history. Now, before we get onto how both World War I and World War II helped mold and accelerate the necessity for health insurance in America, we first have to briefly touch on the real origin of the idea of health insurance to begin with. In 1929, a group of Dallas school teachers contracted with Baylor University, the same university that will place you in the most crippling financial debt imaginable. Like, what the fuck is this to it? Anyways, the university hospital provided the teachers with up to 21 days of inpatient care for 50 cents per month, allowing them the option to receive premium medical care in case of emergency at any time necessary. And before you think, aw, that's so nice of the hospitals to think about the needs of the teachers and their basic medical needs, you clearly don't know this country and understand what capitalism stands for. And yes, I am critiquing this area of capitalism, as despite other European nations having national health insurance plans some 25 years before this, the United States ultimately refrained from adopting this idea because, the big S and C word, the ones that rhyme with communism and yeah, I know that word basically was the biggest scarlet letter anyone could have worn at the time.
Physical appearance counts for nothing. If he openly declares himself to be a communist, we take his word for it. If a person consistently reads and advocates the views expressed in a communist publication, he may be a communist. If a person supports organizations which reflect communist teachings, or organizations labeled communist by the Department of Justice, she may be a communist. If a person defends the activities of communist nations while consistently attacking the domestic and foreign policy of the United States, she may be a communist. If a person does all these things over a period of time, he must be a communist. But there are other communists who don't show their real faces, who work more silently.
But yes, the hospitals couldn't give two shits about your chest pain or broken femur, but instead they did this to offer a steady source of income to hospitals who were at the time experiencing a steep decline in revenue, in partly due to the Great Depression. And this prepaid service model, later referred to as Blue Cross and then developing into Blue Shield programs, would soon be imitated and replicated over the years, with many employers copying this employee insurance linkage that we commonly see with most companies and businesses today, with its popularity only growing with the continued advancements in medicine that came with a hefty out-of-pocket cost. In just a 10-year span, enrollment went from 20.6 million in 1940 to a staggering 142.3 million in 1950 alone. And as I alluded to earlier, the ongoing world wars, especially World War II, represented a turning point for the entirety of the American medical system. America's casual approach to life soon turned out to be a all-out propaganda, war material producing, patriotic, all-American affair, which created increased demand for labor in certain workforces that directly aided the war efforts. So employers looking for another way to entice and retain their workers attracted them with the promise of health insurance, which inevitably became universally adopted throughout America over the next few decades. Fast forward to the introduction of the Social Security Act, the passing of the Hill-Burton Act, the introduction of Medicare and Medicaid. Overall, the healthcare aspect of American life had become more accessible, more expansive, and more inclusive than at any other point in time before. And while the system itself wasn't perfect and definitely held major flaws, the overall direction of its ideals and nature were thought to be going in the right direction. Right?
Cost of their healthcare, which in many cases
right.
Wrong answer, forehead.
So that pretty much covers the backstory of the more important points and origin of the history of healthcare in the US. And to refrain from making this video 4 hours long, we're basically going to skip into the modern day issues with healthcare in general, which is vast to say the least. But easily the biggest gripe with the US healthcare system in this modern day and age, where we can send messages instantaneously across the world, where we have breathtaking advancements in medicine and technology, and where we have an abundance of resources to pretty much achieve anything and everything that we put our mind to, that in the 21st century, Americans still don't have the right to access universal healthcare. What the actual The United States is widely considered to be the only fully developed nation to not have a universal healthcare system. And while the US does have government-backed programs such as Medicare and Medicaid, the stipulations to qualify for either can be head-scratching and pretty lackluster altogether. I know I will get to this section of the video eventually, so for all my uneducated brethren out there, no, Medicare and Medicaid are not the same thing, and yes, I'm going to explain them to give you a better understanding of why these programs aren't really enough to cover the entire US population. Medicare is a federal run program for those of you who are 65 and older. It's not income based and is paid through monthly premiums and deductibles, so this pretty much applies to 0% of my audience. But on the other hand, Medicaid is a joint federal and state-run program that covers people with limited income and resources, and therefore with it being a joint ran program means that qualifications, or disqualifications I should say, can vary based off of the state that you live in.
If we do qualify for Medicaid, which we are like right on the border with our gross annual income, again, it would be free, completely free, at the same birth center, the same hospital, everything would be covered. And what I cannot understand is how like a small difference in income can make your birth either free or $10,000+, and there's nothing in between. There's no like stair step in between for people, because basically like if our gross annual income for me and my husband, for our family of 5, which includes our unborn child, is greater than $84,000 pre-tax, that's pre-tax income. So that's not our take home. I think it's 83 to 85,000 is the range for a family of 5 in Pennsylvania, which again, that's pre-tax. So our take home much lower than that. We are not rich. If it is anywhere above that, we get nothing. But if we do qualify, we get free baby, free healthcare.
I was born with a nevisebaceous cyst beneath the top layer of my skin, and they told me that I needed to get it taken out by the time that I hit puberty. By the time that I got around to approving it, I was already 13. And this has not gotten any easier with age. I've been trying to get this taken out for so long, and every time I just hit another roadblock. In total, over the past years of being an adult, I've gone to about 4 consultations, 2 x-rays, a couple ultrasounds. Every time I have to bring this back up, they make me get new tests to make sure it's still there and the same exact cyst that I'm trying to get taken out of. Last time I got it looked at, I had to go to a hospital about an hour out, where they told me that for it to be covered by my insurance, I had to go to a plastic surgeon in Indianapolis, Indiana. I live 2.5 to 3 hours away from that. And what makes that so is they want me to, keep in mind, I would have to be someone else driving me for these. They would need to drive me there, get a checkup, get it looked at, drive all the way back here, then go back, have someone wait for me for the whole surgery, then have them drive me back again. Not only because I shouldn't be driving right after surgery, but because the fluids that will be draining from my face afterwards will leave me basically blind for a couple days. Now, like any other person, you might be asking, why can't I just do that in my town that has one of the best hospitals in the state? I don't know. I guess I can't have it though. Keep in mind, I'm a former foster youth, which means I'm guaranteed Medicaid until I'm 26, no questions asked. It's already been revoked for me twice for seemingly no reason, and I had to fight like hell to get it back.
Literally anything from your assets to your income to your citizenship can be used against you, and in some cases it can be way worse, like a lot worse.
One story that will always stick to me is that one day I walked into a patient's room and he was sitting in a chair and his wife was on the phone with, I don't know if she was on the phone with Medicaid or some type of insurance, but she had the phone on speaker because she was an older lady, and they were basically on the phone telling her that if her husband were to stay in the long-term care facility that he was at, that they would place a lien on the home because only his name, I guess, was on the home. She was on the phone, y'all, trying to plead with the representative, talking about like, well, what if we take it out of his name and put it in the daughter's name? And they literally was like, no, the government has access to go back, I don't know if it's either 5 or 10 years, and stake claim over that home and put a lien on it and get whatever money that home is worth when that patient dies. Mind you, this is my first time ever hearing something like this. Like in my 31 years of living, I have never heard nothing like this. So I'm like, is this for real? Is this true? Yeah, I looked that shit up online, and lo and behold, it is very much so true.
I don't have insurance, so I had to pay $125 to get a form filled out to prove that I need help paying for my medication. I had to pay $125 for a piece of paper that proves that I can't afford my medication.
The work requirements are 80 hours a month for everyone between 19 and 64, unless you qualify for a medically frail exemption. And this is exactly where the issue lies. It requires states to outline health conditions that would fall under medically frail, but it specifically prevents states from offering blanket exemptions for any medical conditions, which means that if you have cancer or HIV or any other condition that prevents you from working, that doesn't automatically qualify you for the exemption. You could still be required to prove that your symptoms significantly impair your ability to work, and if the government doesn't accept your argument, you would lose your health coverage. Experts are saying that millions of people are expected to lose coverage when this goes into effect on January 1st of next year.
So with all the billions and billions of dollars of our precious tax-paying dollars that go to healthcare each and every year, and the fact that the US alone spends more on healthcare than any other nation, you might wonder yourself, wow, Bradley, why hasn't anyone ever thought about having universal healthcare in America? Well, they have, and to answer the question, I really don't know. At the dawn of the century, presidents such as Theodore Roosevelt, Franklin Roosevelt, Harry Truman, JFK, and Lyndon B. Johnson all called for or lobbied for a form of national health insurance to which proposals and bills would ultimately fail due to its complexity and the perceived overhead costs. Similarly, the thought of a government-ran and sponsored program leaned way too far in the direction of communism or socialism in many people's eyes, which, as you know, is a big no-no in Uncle Sam territory.
The only answer to communism is a massive offensive for freedom.
And even with other nations that are somewhat comparable to the US, such as France and the United Kingdom, creating a sustainable national healthcare system, many figures and organizations heavily pushed back on the matter anytime the idea was brought to fruition. So remember the AMA group that I was talking about earlier, you know, the American Medical Association, that's pretty much a conglomerate of like a bunch of doctors and everything. They were pretty obviously the main opponents of this whole idea of national health insurance, literally creating mass advertisement campaigns with millions in funding to compare the idea of national health care to socialism while describing private or voluntary insurance as the American way. Doctors, a part of the AMA, were terrified of the financial ramifications that enacting such a plan would create, doing anything and everything to push back on the idea and sway patients away from straying too far away from private healthcare. But even moving on some 60 years into the future, and the implementation of national healthcare has remained somewhat hush and even looked down upon by many political figures and people in power. The closest thing that we got to a resemblance of universal healthcare was the Affordable Health Care Act, or ACA, or what many people know it as Obamacare, which was enacted by President Obama in 2010, which greatly expanded the health insurance coverage to allow for more people to qualify, while implementing cost control measures to healthcare premium plans. But this seems to be as far as lawmakers are willing to go when it comes to universal and affordable healthcare. For one, support isn't entirely all there to open that discussion, as the majority of Americans are insured, whether that's through private or government-assisted programs. Secondly, America is a capitalist wet dream.
If you're a guy in your 20s and you don't have a Lamborghini, you should actually sit down and have like a serious discussion with yourself.
Slaves worked all the hours they were awake for their entire lives. I think like if they can do it, so can I.
So why have you pursued earning so much money? Because it's easy. How is it easy to make money then? Because I imagine a lot of our viewers out there are striving for money. But if you can help them out.
The problem is they're striving. You strive for air. I don't strive. The money comes to me.
And national services that undermine the foundation of some of the most tenured and profitable organizations sounds like a never-ending PR and court battling nightmare. Many of those are also not in support of the additional costs that national health insurance would bring, as a bulk of the funding would come from people like you and me in the form of taxes. And as I said earlier, the US already has the largest healthcare bill in all of the world, so adding to that would be a pretty hard pill for most people to swallow. Overall, the long-standing structure of the current healthcare system has its roots in American soil for almost a century now, with the for-profit stakeholders of some of the most financially successful corporations in the world having made the idea of universal healthcare in today's climate almost sound virtually impossible, despite its success in other developed nations. So fine, if we can't implement national health insurance in our society and the framework has been cemented and so many people are covered by these same institutions, then why is it so goddamn expensive? I mean, after all, the main reason for so many people wanting national health insurance is because of how costly health insurance is. And well, to answer that question, you're really gonna understand what greed in the Bible looks like. Remember this guy? Probably not, right? Just some run-of-the-mill big corp bro guys. Well, how about this guy? Starting to look a little bit familiar, right? For those of you who don't know, this is Brian Thompson, but more publicized, this is Louis Mangione. Mangione became infamous for allegedly planning and killing Brian in December of 2024. And yes, murders make the news every day to the point of desensitizing humanity with its frequency, but this killing became extremely profound in media and in pop culture in general.
Martin says she is appalled at the small army of young ladies who call themselves Mangianistas and show up every day at the hearing.
This Ivy League hottie named Luigi is the Robin Hood that we never knew that we needed.
I listened to Luigi's manifesto this morning 3 times and I cried. Honestly, it's beautiful and I agree with him.
At least he left a very powerful message and he highlighted how terrible the healthcare system is in America. I think he'll go down as a hero in history.
I'm just eating it because this is like regular everyday person becoming our hero, our vigilante.
Can you tell us why you like him? What motivated you to come here? That's why. Pardon? He's a hero.
Luigi, free healthcare! Luigi, free healthcare! Luigi, free healthcare! Luigi, free healthcare! How many people have to die?
Target other CEOs, like who the cares? Like let us indulge in this folk hero. Like I'm obsessed with him.
And it wasn't just because it was captured in 4K or because the accused resembled some H&M model, but it gained insane traction online due to the reasoning behind the killings and what it represented. Brian Thompson wasn't just some random Silicon Valley mark or any white-collar businessman. He was the CEO for United Healthcare, one of the largest health insurers in America. The man alone was worth like $43 million, and the company itself generates billions and billions of dollars year on year without fail. But the company, while being a cash cow for American insurance, easily had one of the worst PRs that a health insurer could have. And that's really saying something. Fortune reported that United Healthcare effectively culled or limited some therapy expenses using an algorithm which jeopardized mental health coverage for many Americans, to which a Senate majority staff report revealed that numerous insurers failed to cover the cost of care for older people who fell or had strokes. In 2019, the insurance provider's initial denial rate for post-acute care prior authorization request was 8.7%. By 2022, it had raised to 22.7%.
Wait, what is prior authorization? Here's how it works. Before your doctor provides a treatment, your insurance requires them to prove it's necessary. This is often a time-consuming process that can cause dangerous delays. I'm sorry, your cancer could be cured, but we need to wait for the insurance company to approve your chemotherapy.
United gained a reputation for coverage denial, which leads for its customers who have to pay significant fees out of pocket. The man was sued for inflating company stock, accused of insider trading for profit, and ultimately denied accountability at every turn, using his expertise to drive company profits on the back of the less fortunate. So after he was killed and the semantics of the crime was released, bullet casings reading "deny," "defend," "oppose," phrases used by critics of the tactics insurers use to get out of paying claims, with a manifesto echoing frustrations with the healthcare system that prioritized profit over patient care and the growing disparity between the business of healthcare versus the quality and accessibility of it. No one cried. No one expressed sorrow or remorse over the killing. They celebrated it. They championed the act. They started entire fan clubs and fan pages in honor of a man who just brutally killed somebody in cold blood.
Oh, nah, I ain't seen nothing. I ain't seen nothing. Matter of fact, I'm blind in my left eye and 43% blind in my right eye. I don't see much of nothing. Matter of fact, I can't even see you.
I gotta tell you, man, I usually don't like when somebody gets murdered because it's kind of dark, right? Like when someone actually gets murdered, man, it's like, whoa. But that guy they murdered, the guy named Brian Thompson, the CEO from the United Healthcare, that was a good one.
Brian Thompson, that's all I'm gonna say. That's all I want to say. Brian Thompson, his mom, got me to say something on Inside Edition. I said what I said.
His children are better off without him. They need to learn to not be like their dad and enjoy the blood money.
And it's this reaction, this general consensus that profits are being maximized at the expense of its customers is a phenomenon that seems to be pretty widely accepted across the entirety of the internet. Once you hear story after story of people being faced with astronomical medical bills or people who should have easily qualified for coverage being denied without any fair reasoning. The initial mission has been compromised and has been overcome by the business aspect that is healthcare. And again, the question is why? Well, if you've been watching this video for long enough, I'm pretty sure you've been able to formulate an opinion already. And if greed was your answer, then well, I guess you've been paying attention after all. One of the greatest stories that my father ever told me was the simplest one. The story of a hungry man who went to the villager every day for fish to feed him. And the man would keep coming back day after day after day to receive more fish from the villager. But it wasn't until the villager stopped the hungry man and showed him how to fish for himself that he could catch his own food that the man finally stopped showing up. It's a story of self-sufficiency and independence that can apply to a lot of things in life. But that story does not apply to medical care. So I might have just wasted like the last 30 seconds of your time, but I told it to show you that everyone needs healthcare at some point or another, and companies and shareholders are extremely aware of this fact. We are not doctors, we are not pharmaceutical engineers, we are not miracle healers, we are not Viltrumites. We have no knowledge or no access to the medicines, the treatments, and the procedures that insurers do, which means they have free will to charge whatever the hell they want to charge you, and you don't have any choice but to pay those premiums. And if you don't like it, take the risk of getting sick and having to pay 20 times what you've had to pay for while on insurance. A lot of these coverages do cover very expensive procedures, specialized medications or treatments, but at the end of the day, the markup for the actual cost versus what you end up having to pay is insanely astounding. People across America are paying crazy month-to-month costs with laughable deductibles, laughable premiums, to which the alternative is next to none with how financially limited their options are. And once again, these are privately owned businesses, meaning that they could pretty much do or charge you whatever the hell they want to. I can easily think back to the story of Martin Shkreli, doesn't he just have such a punchable face, who obtained the manufacturing license to the anti-parasitic drug Daraprim, who decided to raise its price from $13.50 per pill to $750 in the span of like 24 hours. I'm sure you could think back to your own medical history where you go to the doctor for one thing and they try to test you for like 20 other things, and it ends up raising your bill from manageable to are you fucking serious? Or you just go to the doctor as a whole with like the most common of symptoms or something like that, and they recommend you X, Y, and Z treatment and take X, Y, and Z pill, and slowly but surely you realize that you're not actually trying to help me, but you're just trying to make my bill longer and longer and longer and longer. Because why charge someone for one thing not knowing if they'll ever come back to you when you could try to get them to do mindless x-rays and screenings to fatten their pockets? The technology used itself can sometimes be labeled as questionable at best. Prime example of this is in prostate cancer surgery, to which despite medical science still having little idea on the best course of treatment for the disease, still going out of the way to introduce a $2 million machine back in 2001 that is now used in 83% of prostatectomies, which has very little evidence to suggest that it is actually better than the cheaper alternatives. And guess who's paying for those Tony Stark looking machines? The greed, the stinginess, the selfishness, the shallowness, pretty much every negative adjective that I can use to describe the profit-obsessed nature that is deeply rooted in the American way of life is the direct contributor to the excessive prices of your healthcare today. So what does that mean for you and me? How are we able to escape these premiums, these plans, these deductibles, and find more affordable health insurance? Well, my friend,
did I ever tell you the definition of insanity?
I'm only kidding. Partially, but honestly speaking, I'm not really sure that there is a solution. Just with everything we get to enjoy in life, living in this current day and age where we get to experience the luxury of having things made for our convenience, to where I don't have to be a handyman by day, doctor by night, and farmer in the morning. These life conveniences where someone or something provides value to us comes with a lot of positives and a lot of negatives. We've grown up in an age where we can receive food in a matter of minutes, have contractors build build the entire structure of the house we live in, manufacturers that make our clothing, people and professionals that give their life or dedicate them to a specific cause or belief system. But at the same time, it's that food that can sometimes poison us, those contractors that can miscalculate estimates that lead to catastrophe, manufacturers that use questionable means of production for profit, and those employed to protect and provide, abusing their power for their own selfish benefit. We have to take the good with the bad, and in this situation, to live in America, it's probably something that I'm going to have to deal with for as long as I live. So the only logical thing I could do in the meantime is to try to just make as much money to where I don't have to worry about it for myself, or my parents don't have to worry about it. For as long as the people in power refuse to acknowledge the basic right for universal health care, there is nothing more that me and you could really do about it. Because my parents will need those medications and those treatments and those procedures to survive, and more than likely yours will too. So as long as that need is there to be fulfilled, best believe someone will be there to capitalize.